Hi, everyone. Thanks for joining today. I'm Beck Reyes. I'm a pediatric nurse practitioner with the Division of Pediatric Neurology here at UCLA Mattel Children's Hospital. And I'm really excited to be able to talk to you today about ketogenic diet. But more specifically, we are going to be debunking common keto myths. So I think this is a really fun and interesting way to introduce ketogenic diet and some of the myths that might be out there. I'm joined today by our two ketogenic dietitians, Sarika Siwak and Jennifer White. They'll be speaking on these common myths in just a few minutes. It's important to note that we won't be able to answer specific medical questions about you or your child. We'll only be able to answer questions that are generally related to ketogenic diet in the treatment of seizures associated with epilepsy. So I'm going to go ahead and get started. The objectives of today's talk are to meet the UCLA diet therapy team, and that would be us. We would identify common myths surrounding ketogenic diet therapies and learn the facts about ketogenic diet therapy. So if you're working with us or if you're working with any ketogenic diet team, it's important to note that it's a multidisciplinary team. And so it's not necessarily just your neurologist or epileptologist that you'll be working with, but you'll be working with perhaps a nurse practitioner like myself, an RN, and then definitely a ketogenic specific dietitian like our team members, Sarika and Jennifer. And here's just a photo of our entire team together. So myth number one is I can do a keto diet on my own. And so it's kind of been a blessing and a curse that ketogenic diet has become so popular in mainstream media now, because there's a lot of misconceptions that you'll be able to go on the internet, find some general guidelines on how to implement ketogenic diet, implement it, and then see some benefit towards the seizures associated with epilepsy. And it's really important to note that while it's generally safe to be on ketogenic diet, there are some associated side effects, and that's why you need to be closely monitored by a ketogenic diet team. It's also important for us to note, how much keto, whether or not it's impacting your epilepsy and seizures, because there are certain tweaks that we can make to the dosage of the diet to help gain even better seizure control. And again, while it's generally safe, there are some associated side effects. So we take note of any underlying conditions. So for example, constipation and reflux can be associated symptoms. If we know about that in the medical history, then that makes it easier for your diet team to work around that, manage those things. And so I myself as a nurse practitioner might evaluate routine urine and blood. And then we'll also check your trace minerals and make sure that you're getting everything that you need to have a nutritionally complete diet. So your diet team, again, will monitor for any side effects that may result from being in ketosis. And it's really important to work with an experienced ketogenic diet team so that they can take note of your specific preferences. If you have any past medical issues, then we can work around those things. So how to work with us. So if you're interested in ketogenic diet, you think that it might be a good form of treatment for you or your child, then you're going to want to discuss this with your primary neurologist or epileptologist. And then that individual can refer you to our ketogenic diet team by calling our appointment center to schedule an initial consultation. Another way of getting a hold of us is by contacting one of our administrative assistants, the wonderful Monica Cruz. And so I have her email below, and then my email for the keto diet program is also on this slide. During your appointment, you should expect to have an evaluation by myself and the ketogenic dietitian. And then based on your history, then we can make recommendations. And if it turns out that you or your child is a candidate for ketogenic diet therapy, there are some pre-diet labs that we would obtain before initiating ketogenic diet. So we'll do that. And then we'll also give you information about the types of diets that we offer here at UCLA that we'll go into more detail in future slides. And then, of course, we want to set initial nutritional goals even before initiating ketogenic diet. So myth number two is keto diet is bad for your health. So there are certain conditions where a person is unable to break down fat as a primary source of fuel. And so if you are one of those individuals, then we would screen for that before we actually initiate ketogenic diet, because then that wouldn't make you a candidate for ketogenic diet. But if you don't have these preconditions or any of these metabolic disorders, then certainly we can proceed. The ketogenic diet team will optimize your nutritional status. So that means that we will put an emphasis on planning whole, real foods. Make sure that you're maintaining a fluid minimum, because one of the possible side effects with ketogenic diet, because it's so acidic in nature, is that it can make your urine acidic and it can put you at risk for kidney stones. So the number one thing that we recommend for our patients before actually starting keto is maintaining that fluid minimum. And then also really important, our dietitians are going to monitor weight to make sure that you're not losing or gaining weight too quickly. And then again, we'll be checking that blood work to make sure that you are safely in ketosis. So the next question tends to be, well, what about my heart? Is a high-fat diet unhealthy for me? Well, something that we check with our program is we would check lipid panels every 3 months to make sure that your cholesterol levels aren't too high. And additionally, we'll screen for any familial history of cardiovascular disease. You might see an initial bump in your triglycerides or lipid values once you initiate diet, but we expect that to normalize over time. And then if we notice that it continues to be elevated, then our dietitians will make recommendations for better heart healthy type fats that we can incorporate into the diet. So with this next myth, I'm going to hand it over to our keto dietitian, Jennifer White.
Thanks, Beck. Sorry, I'm just going to share my screen. Beck, can you see the screen?
Yeah, it's perfect.
Oh, perfect. All right. Don't worry, everyone. I'm much better with food than I am with computers.
Oh, Jen, if you wanted, yeah, perfect. Yeah.
Okay. All right. So we should be
click from current slide. Excellent. Yeah.
Okay. As I said, I do the food. All right. So let's jump into myth number 3 with keto diets are not palatable, or they don't taste good. Ketogenic diets have evolved significantly over the past several years, and nonprofit organizations have spent a lot of time developing recipes and providing cooking tips to families. The Epilepsy Foundation and the Charlie Foundation, both of their websites have great recipes and cooking videos. And an experienced diet therapy team can really work with you to help make your favorite foods keto friendly and maximize your food options. So even foods like pizza and pancakes, chicken nuggets, mac and cheese, all those comfort foods, even something like birthday cake, a diet team can help you, can come up with a recipe for you so that you can have your favorite foods and your favorite snacks. Myth number 4 is eating so much fat is going to make me get fat. I'm going to gain weight on a ketogenic diet. This is definitely a concern that patients, families often cite in the initial assessment. With a diet therapy team, that team will provide guidance on your portions and your caloric intake so that you can maintain a healthy weight, or in the case of children, to make sure that children are growing properly. So at UCLA, our patients follow up in diet therapy clinic, usually every 1 to 3 months. And so that way we can monitor their weight and their growth. And then all of our diet plans are individualized for patients, and the calories are managed and adjusted by the dietitian. But the important thing to remember here is that diet therapy should be treated like a medication. And compliance is key. A medically supervised ketogenic diet is very structured, and you need to treat it like a medication. And so now we thought we would kind of shift gears and do what we like to call Nutrition 101. We just kind of want to give you a basic overview of what all of the nutrients are and what they're actually doing in your body, what their functions are. So a balanced diet consists of the macronutrients, which are fat, protein, and carbohydrate, and then the micronutrients, which are vitamins and minerals, and then water, which is actually extremely important. So let's start with fat, because fat is really the star of the show when it comes to ketogenic diet therapy. It's my personal favorite nutrient. Fat is very nutrient dense. It promotes satiety, which means it helps you feel full, and it keeps you feeling fuller longer. It's an alternative source of fuel for the brain. That's why it works on ketogenic diet. We use it for energy storage. It protects your organs and nerves. It helps you regulate your body temperature. It facilitates your digestive process. And then fat is actually, it's extremely necessary for the digestion, absorption, and transport of the fat-soluble vitamins. And those are vitamins A, D, E, and K. And this is just sort of a fun fact. Your brain is actually the fattest organ in your body, and 60% of your brain is made up of fat, which is kind of cool. This slide just kind of gives you an overview of the different types of fats and what their food sources are. So saturated fats, that's going to be things like butter, coconut oil, mayonnaise, heavy whipping cream. The monounsaturated fats are olive oil, avocado, canola oil. The polyunsaturated fats are things like rapeseed oil, walnut oil, the nuts, seeds. And then omega-3 fatty acids are fatty fish, grass-fed beef, walnuts, and then chia and flax seeds. Carbohydrates, also a very important nutrient when you're talking about ketogenic diet therapy. You'll find out, or you probably already know, they're extremely restricted. Carbohydrates are usually, when you're talking about a traditional American diet, are sort of the main source of calories. A standard American diet is probably 50 to 60% carbohydrate based. So carbohydrates are a source of fuel for the body and the brain. And then I just want to shift a little bit and talk about fiber, because fiber is a type of carbohydrate, but it's a non-digestible type of carbohydrate. So with fiber, it can help reduce your risk for cardiovascular disease. It helps manage your blood sugar. It can promote healthy bowel function and your gut health. And then it can help maintain a healthy body weight for your body type. There are two types of carbohydrates. There are the simple, which are refined carbohydrates, and then the complex, which are unrefined. The starch family, those are foods like breads, pasta, rice, crackers, cookies, etc. Vegetables, fruits, legumes like green beans, peas, peanuts, and then dairy products are carbohydrate. The important thing to remember is that not all carbohydrates are created equal. So fruits and vegetables are definitely going to be your healthiest form of carbohydrates. They contain a lot of vitamins and minerals. They're very nutrient dense, and you get a lot of bang for your buck versus maybe a cup of white pasta, which is not going to be as healthy as a bowl of broccoli or some beautiful blackberries. The last macronutrient is protein. And protein is our body's building blocks. So it directs and regulates our metabolism. It helps our bodies move, and it protects us from infection. And sources for protein are eggs, poultry, this is chicken and turkey, red meat, fish, shellfish, cheese, and then the processed meats, things like bacon and deli meat, salami. And this is a bonus myth buster, actually my favorite. Bacon, cheese, and eggs contain fat, but on a medically supervised ketogenic diet, these foods are actually counted as protein sources and not fat. So the vitamins and minerals are our micronutrients, and vitamins and minerals play a critical role in metabolism, helping you maintain your body's tissues and their functions. And the reality of it is that if you're on a well-balanced, real, whole foods-based diet, it should be nutritionally adequate, right? Now, certain populations or life stages may require supplementation, like if someone's pregnant, they may need a multivitamin, extra vitamin D. But you should always speak with your physician or your dietitian before taking supplements, and always make sure to mention any supplements you're taking when you're in a medical appointment. The last nutrient, and certainly indispensable, is water. Water makes up 60% of an adult's body weight. It has a lot of really important functions in the body. It carries nutrients through the body. It acts as a solvent. It participates in chemical reactions. It helps regulate your temperature. You really can't live without water. Adults need about 8 cups of water daily, and then kids actually need usually anywhere from 4 to 6, often 8 cups of water. So we really need a lot of fluid. And as Beck already mentioned, we have to make sure that patients are meeting their fluid goal before we start them on diet therapy, because being adequately hydrated can really prevent or minimize side effects of ketogenic diet therapy. And I think now I am turning it over to my colleague, Sarika. So I'm actually gonna hop out and let her step in.
Hi, my name is Sarika. Thanks, Jen. My name is Sarika, and I'm one of the other ketogenic dietitians at UCLA. And I get to jump in on myth number 5. So only the classic ketogenic diet is used to treat epilepsy. And we do get this question a lot, where people think that there is only one type of diet therapy. So I'm going to talk to you about what the diet therapies that we have at UCLA. So we have 2 ketone producing diets that we offer at UCLA Medical Center: the classic ketogenic diet and the modified Atkins diet. We also do kind of customized or blended diets using principles of other ketogenic diets, and we'll talk a little bit about all of them in a little more detail. So the classic ketogenic diet is a diet that's high in fat, low in carbohydrate, and moderate in protein. And when we're looking at ketogenic diets, we're looking at kind of the comparison between fat to carbohydrate and protein combined. And that's how we think about the dose of the diet. So when you're looking at like a 2-to-1 to a 4-to-1, that's typically where a ketogenic diet is. At the first number, that 2 being the amount coming from fat, and the second number being the protein and carbohydrate combined. So a few things about a classic ketogenic diet. The number one thing is that we really require a hospital admission for initiating the diet for all of our patients. Usually it's about 3 to 5 days long for the initiation, and that really is where we do all of our diet teaching from the diet perspective and the medical perspective, and also so that patients can be monitored by the nursing staff and the doctors here at the hospital to make sure that the body reacts well to transitioning from carbohydrate metabolism to fat metabolism. Another important part about the classic ketogenic diet is that all of the meals and snacks are calculated in something we call the Keto Diet Calculator, and are measured in grams and are weighed on a gram scale. So for example, if a meal is chicken, broccoli, and butter, that would be created by the dietitian, and the family would have access to that calculator also. And it would be giving you a specific amount of each ingredient that the patient could have to keep at the specific ketogenic diet ratio that they're at. All of the ketogenic diets are going to be calorie controlled. So that, I think, is one of the major pluses of a ketogenic diet, is that it is really structured and there's not a lot of room for error. There's also a lot of transparency between the dietitian and the patient, so that we can really see what meals they're doing, how they're weighing it, and make any adjustments that we need to if the level of ketosis, based on the level of ketosis and the potential response to seizure control. So the modified Atkins diet is the other diet that we offer at UCLA. And just kind of to give some basic highlights of it, again, high fat, low carb, moderate in protein. The modified Atkins diet does not require hospitalization for initiation. So at UCLA, we have our patients and families come to see us in clinic for about a 2-hour clinic visit where we do the diet teaching and on an outpatient basis. And the modified Atkins diet approximates about a 1-to-1 to a 2-to-1 ratio, just to get an idea. Again, that first number being the grams of fat to the amount of protein and carbohydrates combined. So the lower the number, the lower the dose of the diet. So rather than using a gram scale and the calculator for all of the meals to calculate what you're going to eat, we use household measures, things like measuring cups, measuring spoons. And this, for a lot of people, is a positive because some people feel that using the scale to measure all of the food can feel really like medicalizing something as pleasurable as eating. And so this measuring cups and measuring spoons, they belong in the kitchen anyway, so you're commonly using them. So that kind of just can make it feel more flexible or just more typical to what you would be doing when you're eating. The meal plans for the modified Atkins diets are still individualized based on the patient and created by the dietitian. So what we do when we're creating that diet is we're giving how much carbohydrates, fat, and protein the person can have for all of their meals and their snacks. And so we teach you how to count carbohydrates, and then we give protein and fat exchanges. So give you a certain number of servings of protein and fat that you have to have every day to kind of stay in that correct ratio. Both diets are great and both diets can work with good compliance. But one of the things about the modified Atkins diet is that it can be, because it's not quite as precise as the classic ketogenic diet, it does leave a little bit of room for error because you really are relying on the patient and their family to do that carbohydrate counting and to count the protein and fat exchanges. So this slide I really like because it just kind of gives you an idea. So the red kind of looks at the standard American diet, the modified Atkins diet, and the ketogenic diet right next to each other. And the big thing that you can see is that both modified Atkins and ketogenic diets are high in fat. The basis of the diet is coming from fat, whereas in the standard American diet, like Jen said earlier, about 60% of calories are coming from carbohydrate. In a modified Atkins or a ketogenic diet, it really is about maybe between 5 and 10%, but usually about 5% of calories coming from carbohydrates. And the majority of calories, 80 to 90% coming from fat, with the rest going to protein. But with the modified Atkins diet, you're getting a little more flexibility with protein. So just to mention some of the custom and blended diets that we do at UCLA. So we offer the ketogenic diet and we offer the modified Atkins diet. But a lot of times we use principles from other diet therapies, including the modified ketogenic diet, MCT oil diet, and also just whole foods diets. We'll use those principles and weave them into our diet therapies to help them work as best as they can for specific families and for patients. So it really is very customized to people. And just to mention again, just in case anyone missed it, all of these diets they're basically the same. It's just really how you're measuring them. They are all high in fat, they are all low in carbohydrate, and they are all moderate in protein. And they incorporate the same foods and the emphasis is on fat. And both diets that we offer at UCLA will produce ketosis as long as we're getting strict compliance. And the level of ketosis will vary. So moving on to myth number 6, ketogenic diets are only used for weight loss. I know Jen talked a little bit about ketogenic diets and weight loss earlier, but a lot of people come into our clinic and they're concerned because they're saying, wait, you're recommending this diet for our child with epilepsy who does not need weight loss, and this is a weight loss diet. I have 10 friends who are on it. So with the popularity, there is this misconception that it is a diet for weight loss, but it is actually a medically supervised ketogenic diet, is an effective treatment for epilepsy. And the biggest thing about this is that, like we mentioned earlier, our diets are, you work closely with the diet team. And so we're making sure we're checking body weight weekly. We're meeting with you once every 3 months. So making sure that the patients aren't losing weight or aren't gaining weight, that we're just keeping people exactly where they need to be to maintain their weights or to support growth if needed, like the growth is needed. And just to mention, there's a lot of research that's emerging that's also suggesting that ketogenic diet therapies can also be used for treating other neurological conditions outside of epilepsy. Okay, myth number 7 is my favorite myth. Anything labeled keto is okay for me to eat on a keto diet. And I know all of us have gone to the grocery store and seen, packages labeled keto and thinking, wow, okay, great. There's so many options on a keto diet. How can this be restrictive? So just to mention that many ketogenic products, now this isn't saying that anything labeled keto is not allowed. It's just that anything labeled keto, you want to go talk to your diet team first before you're adding it into your diet. So many packaged ketogenic products can be high in carbohydrate and protein. And the other thing is they can also not be high enough in fat, because the fat really is the important part of the diet. So a lot of these highly processed foods can have hidden carbohydrates. They can contain sugar alcohols, which do have a glycemic response and can impact ketosis or decrease ketosis. And a lot of times the nutrition facts, like the nutrition information, is just not accurate or accurate enough to be able to use on a ketogenic diet. So it's important to read food labels. So let's look at a food label together. And we didn't put the front cover of this food product, but this is something that we found, and it's a type of keto-friendly candy that says it's some type of keto candy that says keto on the food label, front label. So let's look at the back label. So we're seeing the label says kind of largely that it contains 2 net carbs, which sounds pretty low, and it says keto on the front. But let's take a look at the nutrition facts label and get an idea of what's inside of this. So the first thing that you want to look at when you're looking at a nutrition facts label is you want to look at the serving size. So on the top, we see that 1 serving, this product in the bag contains 1 serving per container. So it means I can eat the whole container or the whole package and get the numbers that are listed on this nutrition facts label. So for 1 bag of this keto candy, it contains 80 calories. So let's look at a couple of things. Let's first look at the fat. So I'm looking at the fat and I'm seeing 0 grams of fat. So this, for something to be ketogenic, we know the ratio of fat needs to be at a high compared to the ratio of carbohydrates and protein combined. So this product contains no fat at all. So something to note. The next thing that we want to look at is the carbohydrate. So we're seeing it has 37 grams of carbohydrate, which is quite a lot if we're thinking that, in general, ketogenic diets will have somewhere between, 5 to 20 grams of carbohydrate. So it's pretty high. But it does have about 31 grams of fiber. So how we look at net carbs, we're taking the dietary fiber out of the total carbohydrates. So we would take 31 out of 37. So that would give us 6 grams of carb. Looking at the label that they have, they're taking the sugar alcohols out of it too, to get to 2 grams of carb. So I would count this product as 6 grams of carb. I wouldn't remove the sugar alcohols, or maybe remove 1 gram of sugar alcohols and have it be about 5 grams per container. But still, it's not as transparent as it seems. It's not a product that is going to promote ketosis. It doesn't contain any fat, and it still has significant carbohydrates. Now, it's not an absolute no, but it's let me take it to my diet team and let's see how I can make it work on my diet if I really like it. Or if it can't work, maybe we can find something else that we can make at home that we can make it work. Okay. So kind of along the lines of that, with the ingredient list. Oh, I forgot to talk about the ingredient list. Let's just look back for a minute. So the other thing you want to look at when you're looking at a nutrition facts label is you want to look at the ingredient list. And ideally, you want that ingredient list to be short, and you want to know what it actually contains too. So kind of looking at the ingredient list and scrolling to see if there's anything that could mean carbohydrates, anything that could mean sugar. Because you can sometimes, and this label doesn't reflect that, but sometimes it'll say 0 grams of carb, but then you'll see corn syrup solids, and you're like, wait, that contains carbohydrates. So how can there be 0 grams of carb if there's a carb containing ingredient in the list? So you want to take a look at the ingredient list. The next slide has kind of a list of hidden carbohydrates. So we added this just because all of these foods pretty much mean carbohydrate. Now they might have different amounts of carbohydrate. They might have different, cause a different glycemic response, but just to note that these foods all mean carbohydrates. So when you're looking at a product and it says keto friendly or low carb, when you're looking at the ingredient list, if you see something like this, that's something that should give you pause to say, hey, I'm going to take this, I'm going to email it to my diet team to see if this is something I can incorporate, or I'm going to move on and try to find something that doesn't have some of these ingredients. Okay, myth number 8. I don't need a multivitamin. I can get everything I need from food. And this happens a lot, particularly with our families who are on a lot of other medications already. They don't really want to be adding extra pills or vitamins or anything to their regimen. And so we like to be very transparent to say that ketogenic diet therapies are not nutritionally adequate. And you will need to be on some supplement regimen that will be designed by your diet team while you're on diet therapy. And so usually may include, most regimens will include a multivitamin with iron, calcium, and vitamin D. Often we might add other things. We might add probiotics, or we might add omega-3 supplements or other supplements that we might need just to manage side effects, or just to make the diet work better for a specific person, or when we're checking labs, if there's something that we see a deficiency or something that we need to add. So supplements are a necessary part of a medically supervised ketogenic diet therapy. And then just something to also think about, not all supplements are created equal. So liquid and chewable versions, gummies, things like that are usually not allowed on the diet and will contain carbohydrate. So just something else to think about. Okay, myth number 9, my child is on a tube feed and can't be on a ketogenic diet. And I think this is an important one because a lot of emphasis and a lot of information out there, right, that we see is about ketogenic diets with food and recipes. And so for families with a child on a tube feed, wondering how am I going to make this tube feed into a ketogenic tube feed? So there are ketogenic formulas on the market, and even in the past few years, we've seen a lot of new products come on the market. So it's great just giving options to more people who have different kind of nutritional needs. So we have standard formulas, Keto Cal and Keto V. And then we also have a semi-elemental formula called Keto V peptide, and a newer product called Keto Peptide that's a plant-based peptide-based formula. So a lot of options in terms of commercially made formulas. We also use a lot of modulars to get that keto ratio exactly perfect for our specific patient that we're working with. So we might use protein powders or MCT oil or other oils, fiber supplements, all different things that we might be using to get that to get the tube feed to be exactly where we want it to be in terms of ketogenic diet ratio, and also to make it tolerable to the patient who's taking it. We also work with families who prefer home blenderized formulas, or who need to be on a home blenderized formula, and it's customized by the diet team to give you an alternative. And we also work with families who do a little bit of both. So there's a lot of options for families who want to, who are on, for children and adults who are on tube feeds. Okay, myth number 10. I am a vegetarian and I cannot be on a keto diet. So ketogenic diets, we can provide a lot of options and a lot of variety for vegetarians. So it's absolutely totally a myth. We can make a ketogenic diet vegetarian without too much difficulty. There's a wide variety of fruits and vegetables that we can use, and there's also non-meat protein sources we can use. It's important to work closely with your dietitian to make sure to just get the food preferences and to make sure that you're getting so that you're not eating the same thing all the time, to get a little more variety. Vegan diets are a little bit trickier, but they're still absolutely feasible. Sometimes we just have a little bit of trouble with variety, but if you're working with an experienced diet team, we can absolutely do it. In terms of food allergies or food intolerances, things like gluten-free diets or dairy-free or nut-free, these are all diets that can be easily modified to be a ketogenic diet. Picky eating and people with extreme picky eating or extreme selective eating, or people with multiple food allergies, I would say that's not a contraindication. We would still encourage you to make an appointment, come for an initial consult, and just see what the diet team can do for you. A lot of times, maybe one of those custom diets or something, switching to a whole foods diet, or there's a slower way or a different way we can do it. So it's always worth. Don't let the idea that, oh, I'm on a special diet, or I have this food allergy, this food preference, and I can't do a ketogenic diet. It's worth coming and meeting with the diet team to see if you can, because in many cases you can. Okay.
So I'll go ahead and jump in here. Myth number 11 is my child has not failed 2 anti-seizure medications yet, so cannot try keto diet. So for certain conditions that cause seizures associated with epilepsy, like GLUT1 deficiency syndrome or pyruvate dehydrogenase complex deficiency, then that is considered first-line treatment for those conditions, because for those individuals, they have difficulty breaking down glucose and use that as a source of fuel. So the alternative source of fuel would be fat. But also, this is a really good, important question to ask your neurologist. Certainly, we want to try anti-seizure medications as first line, but if there is room to bring ketogenic diet higher up in the treatment algorithm, that's certainly something that you can talk to about with your neurologist, because oftentimes you can use that in conjunction with your current anti-seizure regimen. Another important thing to note, families ask us, well, will it completely control my seizures? For some individuals, ketogenic diet can cause complete resolution of seizures, and in which case then we want to try and decide whether or not we want to start tapering off some of those anti-seizure medications. For some individuals, diet therapy works in conjunction with your current anti-seizure regimen. And so adding on ketogenic diet on top of your anti-seizure medication regimen could improve the control over the seizure activity. So it really varies from individual to individual. So that's why it's important to work with your diet team. And then let's go ahead to the next slide.
I think this is me, right?
Yeah, so for individuals, say, that would not be able to be on ketogenic diet, there are certain types of diets that anybody with epilepsy could certainly benefit from. So that leads us into myth number 12. Which is,
I'm not going to do a ketogenic diet, so there is no point for me to change my eating habits. And that is definitely a myth. The reality of it is that a balanced, healthy diet is beneficial for everyone's health and well-being. The first step to building a better diet is you want to start by eliminating simple sugars and processed foods. And then you're sort of naturally transitioning to what we like to call a real foods-based diet, or some people call it a whole foods-based diet. And with a real foods-based diet, this means that you are eating foods that are in their natural states. So fruits and vegetables that are fresh or frozen. And frozen is totally fine. It's just as healthy as the fresh. Dairy products that are full fat, unsweetened, so yogurt, milk, cheese. You can do 100% whole grain products, but we would recommend limiting the amount. So maybe like 1 or 2 slices of a nice whole grain bread, or maybe a small amount of brown rice, things like that. Poultry, meat, seafood, all of these are considered real foods. We would encourage you to limit processed meats, things like bacon and salami, just because they're not so good for your heart or your colon, but again, in limited amounts, they're okay. And then water should be your primary beverage. You want to eliminate any sugar sweetened beverages. They're just simply don't have a lot of value for your health. And again, this is a diet, this real foods diet, anyone can do it. It's generally healthy for everyone. It's a wonderful step for the whole family to do if they are considering diet therapy. Get everyone on board so that those highly processed, high carbohydrate foods like crackers and cookies and chips and pretzels and sweets, get those things out of the house. But this diet, this real foods diet, you know, the people with epilepsy may see increased benefits from a diet like this. This type of diet can improve your sleep quality. It can help regulate your bowel function. It may improve your immune system. And these are all factors that will impact seizure control. Beck, I'm gonna turn it over to you to wrap up.
Wonderful. So just in summary, ketogenic diet therapy is going to be an effective form of treatment for refractory epilepsy. It's really important that if you decide that you want to do this type of therapy to manage epilepsy, to work with an experienced diet therapy team. That way they can safely make sure that you or your child is safely in ketosis and manage any associated side effects. It's important to note that medically supervised ketogenic diet therapies, they include a variety of healthy foods and they can be individualized for your child's needs. And if you can't, or, you know, go straight into a ketogenic diet, some patients might find benefit in adopting a real foods-based diet that can be beneficial for overall health and well-being and ultimately help with seizure control. And so with that, we go ahead and we open up the floor to any questions anybody may have.
Hi, thank you for your presentation. My name is June, and I have a son that has GLUT1, and he has epilepsy, and he's been having seizures, unfortunately, again. He was seizure-free for a while, for 3.5 years, and then they started back up on anyways in April. But my question is, you're at UCLA. Do you have, he's 17. I need to find a doctor. And we're on modified Atkins / MCT oil type of diet with the dietitians, except I don't really work too closely with them. It's not been very good for me over there now. Our dietitian left.
Oh, that's too bad.
Yeah, she moved away.
Sometimes when our patients lose seizure control, that's a good time to kind of check levels, see, how well in ketosis they may be, if their, patient might be acidotic. I mean, because that could be contributing to an increase in seizures as well. So when we hear this kind of feedback from patients, that's usually the time we start checking levels. So I'm not sure how frequently he's having blood work checked, or if you at home are checking his beta hydroxybutyrate or his urine ketones.
I do urine, and we're going to see the neurologist on. We have an appointment on Wednesday. Actually, he had a big tonic-clonic seizure yesterday, and I had to use the Veltoco rescue spray and stuff. It was kind of scary. So yeah, I'm not sure what's going on, and it's been the last 3 Sundays, and I don't know. We're gonna do lab work when we go. They did lab work. We went to the hospital yesterday, but right here where I live, they don't check the beta hydroxybutyrate because they don't do that there.
Gotcha.
Yeah.
Are you thinking of transitioning to UCLA or?
Yeah, maybe. Is Dr. Wong a physician there, Derek Wong?
Yeah, he's one of our metabolic geneticists that we work closely with conditions like this. So we do co-manage patients with him.
He diagnosed my son.
Oh,
Yeah. So, but my son's 17. So is there, because he's going to be 18, is there doctors that see him? I mean, do I need to transition him to an adult?
yeah. So
Neurologist or metabolic team? How does that, I don't even know where to start, but I think I'm ready for a change.
yeah, so in our program at UCLA, we have an adolescent team. So there's the Adolescent Epilepsy Center. So they accept teenage patients.
Okay.
And if you want to go ahead and put your email in the chat, I'd be happy to send you their way, and their administrative assistant. We also have an adult program as well.
Yeah, he'll be 18 in April, so not far.
Yeah, he's kind of in that gray area where he's adult, but not quite pediatrics yet.
Yeah. Okay. Well, thank you very much. I appreciate that.
Okay, if there aren't any more questions, I think Jen and Sarika, I think we'll go ahead and we can leave our contact in the chat just in case anybody has any more questions. Thanks, everyone. Enjoy your rest of your day.
Thank you, ladies. Have a good day.